Good afternoon, everyone. Welcome to the Center for American Progress. My name is Neera Tandon, and I'm really pleased that you're all here for today's discussion. Over the last few months, the Flint water crisis has drawn the nation's attention to the devastating impact of lead poisoning. As an independent task force concluded in March, the Flint crisis is a tragic and shameful case of environmental injustice. Unfortunately, this environmental injustice is widespread, especially among low-income communities. Roughly 23 million housing units in the United States have one or more lead-based paint hazards, and more than 535,000 children are affected by lead poisoning each year. Let me say that again. 535,000 children are still affected by lead poisoning. This crisis disproportionately affects children of color. A study by the Centers for Disease Control and Prevention determined that 11.2% of African American children are poisoned by lead, compared with 2.3% of white children. These families need action. They deserve justice. They deserve environmental justice. And today, CAP is releasing a new report addressing the possible long-term health effects and economic impacts of underinvesting in low-income communities. The report, authored by Tracy Ross, Rebecca Vallis, and Chelsea Parsons, makes recommendations to federal policymakers on how to ensure low-income families living in environments conducive to their success, including greater funding for efforts to fight lead poisoning and increase investments in community-based violence reduction programs. Going forward, we need to ensure that our leaders take a comprehensive approach to promote safety and healthy environments for all American families, no matter what their zip codes. So it is really my great privilege to introduce someone who worked tirelessly to improve the lives of low-income families, Secretary of Housing and Urban Development, Julián Castro. Secretary Castro likes to call HUD the Department of Opportunity, which makes him the Secretary of Opportunity. And over the last 2 years, I know he's earned that title. Under Secretary Castro's leadership, HUD has expanded opportunities for millions of American families, from providing broadband access for more low-income households to eliminating barriers for those with criminal records to revitalizing high-poverty communities through the administration's Promise Zone program. Following Secretary Castro's remarks, we will be joined by a panel of experts to discuss best practices for lead-free homes and provide insights on how leaders across sectors can work together to ensure that every child lives in a safe and healthy community. Our distinguished panelists include Minneapolis Mayor Betsy Hodges, President and CEO of Green and Healthy Home Initiatives Ruth Ann Norton, and Managing Director of Health and Human Services Program, the Kresge Foundation, for Health and Human Services Program for the Kresge Foundation, David Fukuzawa. We're excited to hear from all of them this afternoon, but first, it is my great pleasure to welcome Secretary Castro to the stage. He is a great friend of the center, and we're honored to have him.
All right, good afternoon. Well, first of all, thank you very much, Neera, for hosting us today and for that kind introduction. And perhaps most importantly, for the fantastic and impactful work that you and your great staff here at CAP do each and every day that is in the interest of Americans of every background. Let's thank CAP for their great leadership. Thank you. I also want to congratulate you all on releasing this new study. I look forward to reading it, but I know that it highlights our nation's urgent need to build safer and healthier communities for all Americans. I also want to thank each of my fellow panelists. I look forward to a good conversation on the issue of how we can ensure that no matter where a young person lives, that they live in a healthy home. I want to recognize and thank Ruth Ann Norton, a longtime partner of HUD. I'm so happy that she could join us this afternoon, as well as Mayor Betsy Hodges from one of the best cities in the United States, Minneapolis. Thank you, Mayor, for your leadership on these issues and for everything that you're doing in Minneapolis and nationwide for so many people. I want to acknowledge and thank David Fukuzawa for everything that he's doing to improve the lives of underserved youth. Thank you, Dave, for your work. And finally, to everybody here, I know that y'all share a passion and a commitment to this work. I want you to know that HUD is proud to join you in achieving this mission. As Neera mentioned, at HUD we call ourselves the Department of Opportunity because housing can serve as a powerful platform to spark greater progress in people's lives. We also know that good health is a vital part of someone's ability to seize any opportunity that comes along in his or her life. Every child in America deserves the chance to grow up in a safe and a healthy home. So at HUD, we're focused on eliminating one of the biggest threats facing children who live in HUD-assisted housing. Last month, we announced a series of bold steps that will protect more young people from the dangers of lead-based paint. We call them our Lead Safe Homes, Lead-Free Kids Toolkit. And I'd like to take just a few moments to discuss some of the changes that we're making. First of all, we're improving how we identify and control lead hazards. We're taking steps to align our lead-safe housing rule with the guidelines set forth by the Centers for Disease Control, the CDC, a measure that should expand protections for nearly 7,000 children across our nation. And we're working to develop a consistent standard for water quality across all HUD-supported properties. Second, we're looking at the effectiveness of our current lead poison prevention policies, and we're coming up with new strategies to improve those policies going forward. Third, we're strengthening our home inspection process and stepping up enforcement against those who break our lead safety rules and endanger young children. Fourth, we're joining forces with leaders across the public and private sectors to connect more HUD-assisted residents with resources that protect them from exposure to lead. This includes working with local public health departments to make free blood lead level testing available to every child under the age of 6 who lives in a HUD-supported home. And earlier today, we launched a new partnership with the National League of Cities, the NLC, a partnership that will lift up the innovative work that local leaders are doing across our country and to make a difference, to make their communities safer and healthier. And then finally, as we push to protect more Americans from the dangers of lead, we'll also remember that the fight doesn't stop there. We'll keep up our commitment to removing other toxic substances found in our nation's homes. Substances like radon, carbon monoxide, and mold that also have such a detrimental impact to the health of our nation's families. So today, I'm proud to announce that we're releasing more than $52 million in grants that will help eliminate lead and other hazards from nearly 3,000 low-income households in our country. These investments will continue the great work of our Office of Lead Hazard Control and Healthy Homes, which since 1993 has served nearly 200,000 households through its grant programs alone. And I really want to thank our staff from the office. I'm not sure if Michelle is here, and thank you all very much. Let's give them a big round of applause, all of our staff. So as we begin our discussion, I want to promise you that our team will not stop working until all children in HUD-supported housing have the chance to grow up in a safe and secure home. A home that lays the foundation for their health, their happiness, and their future success. We know that it's a mission that we can't accomplish without your great work and the great work of so many partners. We'll need the committed, continued support of those partners and everyone in this room, folks dedicated to making our nation safer and healthier than ever. And doing that, one family, one neighborhood, one community at a time. So it's an honor to join you for this important conversation, and I look forward to hearing from you. Thank you.
I'm going to be here. No particular order.
Okay.
So feel free. Sit anywhere.
They said, get in the middle, get in the chair in the middle. So that's,
Good job.
I take direction well here.
Thank you so much for your remarks, Secretary Castro. I might start off with you, and then I'd love for the panelists to join. You know, when we think about the problems of lead, I'd love to just get your sense of why in the year 2016 we still have this problem. I think it was a wake-up call to see the headlines around Flint, Michigan, you know, where we have a community that really feels like it's something out of 50 years ago, that you'd actually have water that's so contaminated. And so I'd just love to get your perspective and invite other folks on the panel after you. Why do we continue to have this challenge? Why are we seeing the levels of disinvestment? How did this happen? And what can we, it sounds from your remarks, HUD is taking, you know, as much action as it can, but what else can be done in the country?
Yeah, and thank you again for having all of us for this important conversation. You're right. I think when we heard about what had happened in Flint, that the reaction of most folks was, you know, this is 2016. Why is this still happening? And of course, that was a particular case, and bad decisions that were made there, I think, in the state that exacerbated the challenge there. But the fact is, and anybody up here can tell you, that one of the biggest challenges we have is lead in paint in homes still today. And why do we have that? Well, different reasons. One of those is that we have a whole bunch of homes out there that still have that lead-based paint in them. And the resources have not been dedicated over time to remediate nearly the number of units that we need to remediate in the United States. It's often the case that folks are living in low-income communities, and oftentimes they're unaware of the problem. Or if they are aware, they're not able to just go out and remediate the problem themselves. And so they need assistance in doing that. Now, that's the challenge, that we still have a very strong need for investment in resources. The good news is that over the years we have gotten better about trying to be responsive in the nonprofit sector, in the public sector, through partnerships with the private sector as well. I mentioned in my remarks, for instance, that since 1992 or 1993, our Office of Lead Hazard Control and Healthy Homes has been making important investments that go into private housing in low-income communities and help them remediate those lead hazards and other health hazards in their homes. At the same time, this push that we're making today is really all about improving what we do with HUD-assisted housing. We serve millions of children in HUD-assisted housing. And I'll talk a little bit later about some of the ways that we're trying to improve our processes and how we identify and then remediate challenges that we have. But the direct answer to your question is, I think if I had to put or my finger on one challenge, it would be that we have not dedicated the kind of resources that ought to be dedicated to the problem. And we need to do a better job of that.
I would love your view, Ruth Ann Norton, on this topic. I mean, your organization is one of the leading organizations addressing the issue of lead and throughout the country, in houses and elsewhere. And how, just give us a sense of how pervasive this challenge is. What is the most effective strategy in low-income communities, and what you're seeing are the impacts on children today of the problem, and then how are solutions working to solve that?
That's a really big question. I'm trying to take pieces of that. But
we can come back on some of them
absolutely.
too.
And I do want to quickly commend HUD on the great work that we're doing to advance the care and protection and prevention in public housing. So good job on that. But I think the toxic legacy of lead poisoning in this country has haunted us all the way back to the 1920s, when the United States failed to sign with the other countries around the world through the League of Nations the ban on lead-based paint. It took us 57 years to follow the majority of countries in this world on something that we knew in the early 1900s were killing children in communities, In my own city of Baltimore, children were still dying of lead as late as the 50s and the 60s. But what we know is that lead is a powerful neurotoxin that even at its smallest amount will damage a child's brain and devastate their ability to be able to learn and compete in the classroom. They are 7 times more likely to drop out of school. They're going to be far more likely to not be able to compete in the workplace, earning less over time. It disrupts pregnancy, increasing stillbirths and miscarriages. It has an impact on cardiac arrest and early mortality. And most of this has occurred in our lowest income communities where housing condition has undermined not only the health of our children and our families, but our ability to actually put people on equal footing. If we know, and we have long known, that if we prevent lead poisoning, we not only have up to $221 return in taxpayer dollars, so a strong business case, but the moral case is that kids will be able to compete in the classroom. They will be much more competitive and much better citizens in Minneapolis and Baltimore and around the country. And so this is something that we know how to find it. We know, as the National Center says, how to fix it and fund it. Right? We have to engage communities and Congress and our local organizations and local legislatures to actually put money into this because it works when we do it. We have to have better enforcement. And by funding and enforcement and education, in Maryland, we have reduced childhood lead poisoning by 99%, returning $10.5 billion back to our economy. We can do that around the country and are trying to do that. So that's a start to your...
Great. Mayor Hodges, I would just love to get your sense on how you're dealing with this in your city. This is a kind of dispersed problem, and so particularly with the private sector, addressing lead exposure has ended up being primarily a local issue. So what are you doing in your city to ensure residents are protected?
Well, it's certainly a big issue. As it is across the country, it's a big issue in Minneapolis, and it's an equity issue in Minneapolis. 32% of the folks in Minneapolis are people of color, 44% of people exposed who have elevated levels of lead are people of color. 75% of the children that we test are living in rental housing. And so that's one of the places where we focused is we have the laws on the books, but it is still, making sure our inspectors are up to speed, making sure that we are doing what we can when we are doing inspections to make sure that the homeowner, the actual property owner is aware of the remediation and the work that they need to do. And if they're going to do work on the house, by all means, we have to work with them to make sure that it's safe regarding lead. We are also doing, right now, at least in Minneapolis, and I'm guessing this is true in other places, the biggest lead detector we have are kids. Right? The way we find out that there's lead in a house is because a kid has elevated lead levels and we retroactively go back to the house. And so one of the things we are doing, we have pilot projects in Minneapolis right now where we know predictably where the homes with elevated, where kids are more likely to have elevated lead levels, where the homes are more likely to still have lead paint or access to lead for young people. And so we are proactively going door to door in the places where we can predict that there is likely to be lead exposure and trying to do the abatement that way as opposed to using kids as our lead detectors. And those pilot projects, I've put those in my budget. We've had support and partnership at the federal level for that work. We test kids. About 65% of our 2 and 3 year olds have been tested, which is good, but we need more. And we're doing outreach and education, and we're trying to do it in all the languages that we can, in the languages that people are more likely to speak, and trying to do it in ways that are going to where people are rather than waiting for people to come to us, and in the moments and the opportunities that we have. But working with those property owners in those rental properties is a key place for outreach that we have.
Yeah, so I would love to turn to Flint, but let me just follow up on a comment Ruth Ann made, which is when we know that we do save so much money over a long term for actually dealing with lead abatement when it's $221, when for $221 a return for the investment you make. Why is this still such a problem? Is it because property owners don't want to make the investment? We as a country haven't decided it's kind of a priority. It's low-income communities that people aren't really focused on. I'd love to get Secretary Castro's view and really the panelist's view, and then I'd love to turn it over to Flint.
Yeah, and I speak as a, of course, also as a former mayor, and now seeing this from the federal level. If I had to say if there's one challenge, it's competing priorities. There's so many needs out there, and whether it's at the local level, the state level, the federal level, there are significant resources that go into remediating these hazards, but not nearly enough to get the job fully done.
If I can, I think one of the things is that we really have to understand what Mayor Hodges understands and what then Mayor Castro understood in San Antonio is you have to set standards for this, though. We should have no federal dollar, no philanthropic dollar, no local dollar that goes into housing intervention that needs to address housing condition in America that doesn't say lead safe isn't the standard. What we found in our work in the 25 cities where we're working around the country is by setting those standards, you actually move the market, and that helps to bring private investment. And I have to really commend you on this idea of doing preemptive inspection, and it should be the standard of care in every housing department and every health department in America to look at this, because you're not only going to lower the incidence of lead poisoning, which is devastating on our school systems and on our juvenile justice systems in our community, but you're going to have a major impact on asthma, you're going to have a major impact on fall prevention for seniors, and you will build a baseline of healthier housing on which families can launch and thrive. But you've got to believe in enforcement, and that enforcement will in fact not drive away investment, but what we found in Baltimore is that it will bring investment.
Great. David, I would love to get your comments. Obviously, you're working in this right now. Kresge joined 9 other foundations to really work in Flint, and Flint did help capture the public's attention to this broader challenge. What have you learned so far in working with leaders in Flint about this challenge that really affected water? It was a water poisoning challenge that could help instruct us on the broader issues of lead.
Yeah, sure, Nora. Although, just to be clear, we're neighbors of Flint, but we're not in Flint, and we've just been invited to help them, and we've been talking to the community for a while. But I want to respond to your earlier question about what happened, and because my answer to that is that we collectively dropped the ball, because the good news is that rates have actually been improving in terms of reduction of elevated blood lead levels. So I think people just thought, we had sort of like taken care of it. But when we started doing this kind of grant making in 2008, so it's almost 10 years, what we found was that the only significant funder in this area doing anything was HUD. I mean, HUD was the most important public health agency in the federal government, beyond CDC, beyond HHS. Not to say that they weren't concerned about it, just that in terms of actual resources, that's where the money was. There were no national funders that were interested in this work. And what compelled us is that, look, we can fix this problem. And it's not just a housing problem. There was a study not done too long ago, 4 years ago, by University of Michigan, looking at the elevated blood levels of Detroit public school kids. And they tracked them through 3rd, 5th, and 6th grades, 7th grades, I believe. And what they found was that there was a statistically significant impact on standardized test scores. Now, I've been in philanthropy for 20 years, and I will tell you that if you could tell a school reformer that I can reduce, I can improve your standardized test scores without a single new teacher, without a single new classroom, without any computers, why wouldn't you do it? And it would cost less money. And the effects would be enduring. This would be a one-time investment. This would not be why wouldn't you do it? I even wrote an op-ed to that effect after that the research came out, because that to me was a smoking gun. And I don't want to diss anybody in K-12, but it seems to me that this was a huge opportunity to think about this. And I was just telling Ruth Ann recently that a local hospital in Cleveland discovered that where their kids were, and this is with the Children's Hospital, where the kids were coming from who had elevated blood lead levels, they were all coming from a certain neighborhood. And then when they interposed crime rates from the city, it was, as you can imagine, there was like an overlay of where the crime was, and the hospital realized we have to do a better job. And it can't be just simply fixing the blood lead levels. It really, we have to fix the houses. And I think part of the issue is that this really is, as money is as critical as it is, to Ruth Ann's point, this is a policy issue. It is a development issue, because the reason that low-income people are living in these houses is because they have no other choice. And that is the issue. And whether they get poisoned or sick, often if they manage to escape those things, they may get evicted. So all these things are kind of cumulative and have impacts on people in poverty.
But is this like just a broad collective action problem? Because David's making the point, which is just really reinforcing your point, which is that it's a conspiracy. There's a number of ways in which we pay for not taking action on lead earlier. So we pay in test scores, we pay or lower test scores, which means lower, essentially down the road, lower economic performance in the country. We pay in, seems like, criminal justice issues. We pay in welfare issues for not making this kind of concerted investment. And when you make the point that HUD is actually the biggest investor in addressing this problem, but yet you don't see. I mean, that's phenomenal, and we have a phenomenal secretary, but it seems a little odd that CDC isn't making these kinds of investments. So at the end of the day, how do we catalyze that? And I really wanted to just get to this particular issue, which is, we should just be honest. There are many HUD programs that are underfunded, and and to address this large-scale problem, what additional authority would HUD need to take it on?
Yeah, well, of course.
Ruth Ann and others jump in.
And to the administration's credit, earlier in the administration, they did up the level, and we did get an increase in funding for these programs. However, that's still not enough to meet either the demand or certainly not the need. Just to give you a sense of that, we're able to fund about half of the eligible applicants for this program.
And that's an increase.
That's after the increase from a couple of years back. But there are a number of things that we're doing in the meantime that I mentioned in my remarks of enhancing enforcement, as Ruth Ann has said, looking at how we can do a better job of identifying where problems exist in the first place. A specific example of that, for instance, is that we have different standards for the inspection process when it comes to Section 8 housing. Right now, they rely on what's called a visual inspection, which is not actually the best way to detect a lead problem. We want to be able to go in there and do a fuller lead risk assessment. For that, we need a statutory change, and that's one of the things that we've put on the table. Fortunately, you have a number of good senators and congressional representatives like Durbin and Ellison from Minneapolis that are working on these issues. So if we can improve enforcement, if we can get better about identifying where issues exist, and in the future, if we can get additional resources, and then what y'all have been talking about, which is really it's going to take a whole bunch of different levels of the public sector and agencies within the public sector and nonprofits and the private sector. And these things, a forum like this is so important because it begins with making it a stronger priority. If we can accomplish those things, I think that we can bring down the level of incidents that we see in young people who have elevated blood lead levels.
And I do think, there was a presidential task force on lead poisoning prevention that a decade or more ago called for a $250 million a year investment by Congress. We've never gotten close, and yet it is, if not the best performing program in the United States government. And if we can't fund that, then we have really got to put some pressure on Congress, or those of us who can do that, to put some pressure there, because I think both sides of the aisle have agreed that lead poisoning is something that we need to eliminate in this country. It has been bipartisan, and it is a bipartisan opportunity for this country. But if you're an education funder, you will never get to grade level reading. You will never get to graduation rates in communities that are so hard hit by lead poisoning unless you invest in lead prevention and in housing condition. But we also have to compel hospital community benefit programs that are mandated by the IRS to invest in communities, to put more into our housing stock and into the health. And we have to look at the healthcare financing mechanisms through Medicaid and others of where they can be a co-contributor into how we fund this. And I think we also have to look at and see what the future is of pay for success and social impact bonds to help bring in private investment and welcome private investment for things that work, that can build capitalization in communities around this country. And the last piece, I think, is that we have to be honest about the many, many communities that can't even apply to HUD because they don't have the resources to test children, to test houses, to get the data, where we know kids are getting poisoned, but they are completely left behind because they don't have the infrastructure to even be able to make the case for an issue that, if we put our minds to it, we truly can solve as a major public health threat, I think, within 5 years in this country. And we have to make the political will and the public will commitment to that.
You want to add to that?
Well, I would add to
That's
that.
great, thank you.
I think there's also room to make the case, particularly to policymakers, about what's in it for the people that they represent. That, this is a moment at which people's eyes have been turned to the perils of lead poisoning. If there's, anything good that can come from the tragedy that's happened in Flint, it's that people's attention has turned more to it. But I think for a lot of folks, it's not seen as sexy. Oh, yes, yes, let's make sure kids are healthy. But the fact that it does have an impact on the education system that people are trying so hard to have a positive impact on, and the opportunity gaps that young people face between white people and between white kids and kids of color, that neurological development for our youngest is hugely impacted by exposure to lead in those first 3 years. I have a Cradle to K cabinet that's focused on 0 to 3-year-olds, and healthy homes and lead-safe homes are part of that Cradle to K cabinet recommendations, because you see the impact on that, not just in the child at that age, but later as teenagers. And as you were referencing, some of the criminal activity that we see, some of the violent activity we see among young people in their later teens and early 20s, you can trace back exposure to lead for a lot of those young people, and that it had an impact on their neurological development, which had an impact perhaps later on behavior, and threading that through, and that is a place that the CDC could be helpful. But making that case that this is important for the health of the entire community and the future of the community, I think could then help make the case for, and that's why this investment is so crucial.
To come back to the Flint example, is that the people in Flint, their perspective on this is that, yes, this was a terrible tragedy, which, we will have to endure now for a generation or two. But for them, this was simply one factor in many. And sort of to work backwards from Mayor Hodges' example, where you're working from, the many issues to the one, this issue can help us move from, can be a window into all the things that, low-income communities are experiencing. This happens to be an insult, especially to children, that we can fix. Of all the things, that we can do. And it seems to me that, again, if we could find something, everyone's talking about the silver bullet, and this is like the lead bullet that we can fix. This is a fixable, finite problem because it's to older houses basically in this country, and we know where they are. We have the data. and we can target our resources. So it's not like we have to figure this out. So, but it's a way to sort of look at why low-income communities don't thrive. And this is one thing, but it's one thing among many things.
But Ruth Ann mentioned bipartisanship, and you were talking about Flint, and I have to say, it's vital that we all focus on this as a key lever for change in communities. But it's not like addressing Flint was an easy issue in Congress, right? So we have a kind of national crisis, and there's still incredible wrangling about just trying to solve that crisis. And so I do want to raise the kind of larger issue of how to, this is one of many challenges, but in many ways an easier challenge to fix, as you're saying, David, in low-income communities, and yet it's still never gotten the full funding. How do we make the case to people who are recalcitrant about spending federal dollars, even on challenges that have a huge payoff, that this makes sense? I mean, honestly, do we think if we had these issues in high-income communities, we wouldn't have probably solved this problem a long time ago? So how do we make that case for people who are, may think, I don't represent these folks, or it's not as big a problem, or, we have people who are not willing to address Flint today. So
Let me give you the flip side of reducing childhood lead poisoning in Maryland by close to 99%. Mm-hmm. In Baltimore, we still grapple deeply with housing condition, right? But the profile of the child poisoned in the state of Maryland today is coming from a middle-class homeowner-occupied property.
And that happened how?
Because we drove down and really concentrated on rental property, and we are still concentrating in very low-income communities, and we have a long way to go. We still have 2,000 kids a year with levels of 5 micrograms per deciliter and above. So that's going into our education system every year. This is an issue that in July of 1992 got Congress's attention with the CDC, but also in part because on the cover of Newsweek was a small, blonde-headed, blue-eyed child who was the daughter of 2 lawyers in Massachusetts, and people looked at that magazine cover and said, us too. And the fact of the matter is, lead is an us too issue, because when a child doesn't perform well, when they can't earn well, it hurts all of us. And mayors know that well, communities know that. But this is an issue that even without the action of Congress, which I think we should never do this without having good money for HUD, can be addressed at the local level, can be addressed by community action that is there, but shouldn't be. And we should not wait another day. If you knew that your child was being brain damaged, right? Your hair's on fire and you want to run down the aisle and do something about it right now. It is so fixable. And I think we need a stronger chorus of major leaders who are selling this business case and this moral case across the country. We're trying to bring together a national summit in December for the next administration that will come in and deal with this. But we have got to turn on the jets and say, we can't come back every 5 years and have another crisis about lead poisoning, which is what we do. And it's like we rediscover poverty and we rediscover that people are not treated fairly. But in this country, investing in housing condition will make such a difference in so many other areas.
Yeah, I think Ruth Ann says it better than I'll ever say it, and she's been doing such fantastic work for so many years on this. There's a business case clearly that's there to be made. There's more and more research, not just on this, but on the broader link between investing in health and investing in housing, and the fact that if you invest at the front end, you're going to save on the back end. And so the more evidence that we get of that, the more we're speaking the language of folks who usually are hard to persuade to make these kinds of investments. And my hope is that through the work that y'all are doing, that others are doing, we're going to continue to build a stronger and stronger case. One of the other things that HUD does is that we do support research, and that's certainly one of the things that we're thinking about. How do you build that case?
And I can affirm that this is an us too problem. On the flight here this morning, I was sitting across the aisle from a man who said, "Are you the mayor of Minneapolis?" Yes. You know, we got into conversation and he asked why I was flying here. And I told him that I was here to talk about lead safety. And he told the story. You know, he was flying to DC to do a sales pitch in Bethesda, and he lives in St. Paul. And he was telling the story of knowing he had lead paint in his home and knowing that other paints wouldn't stick to it very well, and so he wanted to remediate that himself, and he'd done some sanding so that the paint that he put on later would stick to the lead paint. And then later he came to find that his child, you know, his 2-year-old child, had elevated levels of lead. And he was horrified to find that, and he wanted to tell me that story, and that he hadn't quite known that exactly how it worked. And you know, this is about, there are a lot of people in urban areas living in very old homes. My home was built in 1907. A lot of people were living in very old homes at all income levels who have or are going to face this issue, who may not know that they are going to face this issue. And the more we can make our case, I think the easier it's going to be to leverage support for resource.
You know, this issue you pointed out, and I'll give a pitch here for GHHI. Because, you know, if there's lead in the house, there's other bad things there too. You know, there's likely to be mold and dust and rodents, pesticides, things like that. You know, and by the way, if we're going to go into that house and make it healthier, we can also make it greener. And so there's an opportunity here if we think about, you know, wise investments, you know, to really have kind of a win-win-win, and sort of thinking about these communities so that they end up not only having fewer lead poisoned kids, but fewer cases of asthma. So obviously, you know, if you can fix one, you can begin to fix the other. And I mean, these are issues which, you know, the healthcare system is concerned about. Obviously, the education system is concerned about. Housers are concerned about this, and you know, and people are concerned about the environment. And so this ought to be an agenda that we can, you know, get around. Especially, and I would have to say, you know, pay great tribute to, especially, I would say, civic leadership. I mean, this is really critical right now, because this is not, it's a national problem, but we tackle it at a city level. And that's why.
Turn it over to questions. In 1 second, I'll just ask one question of Secretary Castro, which is, in the crises we're facing now, are you seeing a concerted action by HUD as well as other departments, CDC, et cetera?
Oh, absolutely, yeah. You know, across the administration, you know, we're part of this Children's Environmental Health Task Force, where 8 federal agencies are working together on these issues. There are some investments that other agencies make, and so even as we came out with this toolkit, the Lead Safe Homes, Lead-Free Kids toolkit, we coordinated with other agencies within the federal government to make sure that all of us are on the same page. It's something that the administration has been committed to. So there is a lot of good work that's happening throughout the administration on this. HUD is not the only one doing it.
Great. I'll take questions if you will just identify yourself. And again, we're going to try and get a bunch of questions in, so if you can make your questions shorter, that would be great. In the back.
Hi, I'm Ellen Taylor. I actually used to work for the Office of Healthy Homes and Lead Control. But I want to know what the tort situation is right now. I remember the state of Rhode Island tried to go after the paint companies. What's going on, Ruth Ann?
Hi, Ellen. Good to see you. So the latest is in California. The paint companies were held liable for, I think, $1.1 billion. 10 or 11 counties came together and sued the paint companies, and is now going through the appeals process. In Rhode Island, Sheldon Whitehouse, when he was the Attorney General, had a successful suit against the paint companies, and it was then overturned on appeal. It is very clear that the lead paint manufacturers and pigment manufacturers that go all the way back to a century and more in this country need to contribute much more. It's a very difficult case to prove because of statute of limitations and who made what paint. But I think on a moral compass basis and from a corporate level, we need to be compelling some pretty strong contribution one way or the other through the court system or through a lot of corporate pressure on these pigment manufacturers and paint companies still today to help us. And to some degree, it's in their best interest. The more that we do repair and renovation and we
more
improve
paint people are
houses,
buying.
the more paint they're going to buy, the more windows people are going to buy, and the more investment. So it can be a win-win for everybody.
There was someone else over there.
Hi, good afternoon. My name is Latricia Adams. I'm the founder and president of a grassroots organization called Black Millennials for Flint. My question, and anyone can answer on the panel, it sounds like there are great measures that are taking place in regards to being more proactive about lead exposure. Could anyone speak to anything that's taking place to think about the actual impact of lead exposure that has already happened specifically to children? So it's great that we have these innovative things that are in place, but what about the effects that have already taken place, specifically thinking about children that exist in Flint and other areas throughout the country?
Question.
David, do you want to?
Well, there in Flint, you have Dr. Mona, of course. So the best I can do is really echo a lot of things that she's been saying, but which is true, and that is by just taking care of the health of those kids and making sure that they get really good nutrition, and certainly no further exposure is really, really important. And that becomes significant in a city like Flint. And I don't want to speak for your city, but when they've lost the last grocery store, and now they're getting another one, but that's a problem. If kids can't get fresh, healthy food, and that's an issue which is true in many, many low-income communities across the country. So, nutrition is a vital part of the, I think, certainly treatment, and it's not necessarily a lifelong death sentence. That that there's ways that if you have very strong supports, both educational and personal, as well as nutritional, those kids have a chance.
I would just add that I think it's safe to say that the majority of our efforts are really focused on prevention, but that doesn't mean that we forget about the children who, do have elevated blood lead levels. In fact, one of the things that we're doing now is stepping up our partnership with local health departments and trying to ensure that they do get better care and from better testing to detect kids who have elevated blood lead levels to what happens after that, so that the learning challenges that they have, other health challenges that they have, can be addressed. And the fact is that this shouldn't be a sentence that somebody has to endure, that if it's addressed appropriately, then they still have tremendous potential. At least that's what we have to work toward. And we're committed to doing better of partnering with local agencies so that they have the best chance possible.
Over here, and then I'll go over there.
Hi, thank you all for your work to prevent lead poisoning and to treat it. My name is Becky Levin. I'm with AFSCME, the American Federation of State, County, and Municipal Employees. I'm also wondering about lead exposure that's in schools. Lead paint is not only in homes, but we have a lot of really horrible infrastructure in schools and not enough funding to fix that. And I'm wondering what kind of efforts you may be involved in, or what's being done to address lead exposure through schools. Not just through paint, but we've all seen about lead in the water, and there are a number of stories. USA Today ran a big story about lead problems in water, and unfortunately it seems the federal government can't regulate water in schools the way it regulates water in people's homes. So I was just wondering if you could comment on that.
Go ahead.
I think one of the places that we have seen in schools is the lead and water crisis, which actually began in Philadelphia, rolled out in Baltimore, and many other places around school systems. And it is an aging infrastructure issue, but it is incumbent upon the maintenance standards for schools to really address the paint and water issues and soil, because we have a lot of kids playing in playgrounds in urban areas and rural areas where there have been smelters, where there is deteriorating paint. And we've got to have action on standards for maintenance for schools until we're able to rebuild. Because in many of our aging cities, building a new school is out of reach. And being able to look at that. EPA does have the power to help in testing and knowing what those test results are and sharing to the public. And we certainly have been very loud about EPA moving more quickly in disclosure of what they know to the public and directly to the public, because I think every parent has a right to know what the water safety is in a school and if there's other issues as well. And I think I was recently quoted in a publication saying that I think that we need a lot of parent action, but we also need a lot of state superintendents making sure that the maintenance standards in schools are up to speed and up to snuff, the same that we're trying to do this in housing.
Is Claire Barnett in the, because, Claire Barnett, is it the coalition or the
Healthy Schools, right?
Healthy, campaign or
Alliance or something.
Yeah, I forget she'll kill me
She's
if I
great.
forgot her name. Has been the real champion for this and other issues. The difficulty is that a lot more, I believe, needs to be done in this particular area, but it gets into issues around school funding and local control, and it gets tricky. It's very difficult to deal with from the federal level for sure, because of that reason. So it has to be done largely on a local level, which means that you really have to get organized, throughout the country, which is what Claire's organization is trying to do, and others, because it's not just lead, but other exposures that kids have on a daily basis, not only internal to the school, whether it's from asbestos, things like that, or external exposures, because we've seen lots of examples where schools are sited near coal ash or polluting industries, et cetera. So it's certainly an issue that I think deserves a lot more attention.
Was someone over there? Yep, over there. And unfortunately, I think this has to be our last question, just because of time. Oh, I was over there. Sorry. No offense.
I'm Joanna. I'm with the National Conference of State Legislators, but I'm graduating from the University of Michigan next year, so right next door to Flint. I'm so glad that you brought this to a broader topic of pollution, because it's not just Flint that's been affected by this. It's the residents of 48217, which I'm sure you've heard about. It's Southwest Detroit in Michigan. It's the most polluted zip code in all of Michigan. Not only have they had to battle a weak city government the way that Flint had to, but the reason why that zip code is so polluted is because big business Marathon Oil Corporation lives right next door to them. So I wonder, for you guys, like, what's the thing that we need to improve most on? Poverty, pollution, big business, or your relationship with the government?
Well, let me just say, well, first of all, thank you for bringing that, or highlighting that. And I'm sure that, we could tell that story in just about every big city and even some smaller communities out there. It really strikes the heart of environmental justice and making sure that, at least I'll just speak from my perspective at HUD and then, kind of looking at it from the federal agency perspective. That's why it's so important that during this administration that we've begun to coordinate our efforts, particularly on place-based work, a lot better. And starting there with understanding, what can we be doing on housing, what can the EPA be doing, what can we be doing in education, transportation, and so forth to create healthier communities, obviously working with our local partners who are always going to be in the lead. But then going forward, how do we take that one step further and affect policy that actually ensures that we're going to have healthier neighborhoods out there? Because some of it is place specific, but a lot of it is, you can impact it by smarter policy. So for us, one of the things that we can think about, for instance, is how do we treat communities that have particular environmental health hazards when we do our CDBG formula funding, when we do our home funding, when we do our competitive grants like Choice or others, and look at ways that we can take that more into account in the future. We only have 6 months left in this administration, but you can bet that there's a lot of thinking going on in terms of how we can be smarter going forward based on everything that we've learned over these last few years.
It's a great ending to the discussion. I want to say one last word, which is that we at CAP work on a lot of intractable problems, and school readiness, et cetera, poverty, it's actually both refreshing and frustrating to work on a problem that has sort of an easy pathway to success, but yet we still have difficulty doing it, but not for lack of trying from everyone in this room. And I particularly want to thank the Secretary for your leadership on this issue, your focus, and your effort to corral the government to make sure we're actually addressing this fixable problem for our communities. Thank you all very much. Thanks, everybody.